Good evening. I get it all at once. In the afternoon, I have to say good afternoon 3 times, but this is a very good crowd, so thank you. I just needed one. So welcome to our first collaborative event of the semester. We are pleased and proud to be in collaboration with Geisinger, Commonwealth School of Medicine, and Dr. Scheinman, the dean, is here, and we welcome him to our turf. There is poetic justice in the collaboration because tonight's speaker, Dr. Denny Dawgert, is a devout member of the Schemmel Forum, and I would say an invaluable asset to the medical college. Denny and his wife, Grace, have been coming to the Schemmel Forum since day one, but it's the first time that Denny comes as a speaker, and the size of the audience speaks volumes to how welcome he is in that role. The Dawgert's interests range from literature to classics and philosophy to science and technology. Dr. Dawgert has ceased practicing pediatric medicine. He is not exactly retired. He is in a new chapter of his life, serving the medical school as a professor and active in its administration. He has always had a keen interest in preventative medicine for children and has become a strong advocate for the overcoming ACEs, adverse childhood experiences, that have had devastating effects on our children. Studies reveal that the effects of ACE range from learning disabilities to shortening life expectancy. We've invited Denny to tell us more about that condition and what can be done to alleviate it. So please welcome him to the podium.
It's a real honor to be invited to speak here at this facility at the University of Scranton. I was thinking on the way over here that it's sort of the trifecta for me. In June of this year, I celebrated my 50th graduating class reunion in this room from the University of Scranton. The medical college is an organization that I love working with, and it has been a wonderful asset for me to be able to be there and provide what I can. And it has been really, really amazing, an experience to be there. I'm glad that Dr. Scheinman is here with us tonight. And the third part of the trifecta is it's the Schemmel Forum, which is twofold an honor for me. It's a wonderful adult education program that's been going on for years and really touches many aspects. But the most important part of the Schemmel Forum is that it's named after George Schemmel, a Jesuit who lived here and worked here for many years. George Schemmel, in the finally 10 or 15 years of his life, grew to be a very close friend of mine, a mentor, a teacher, and my own personal spiritual advisor. So to be able to give a talk at something that's named after George is particularly humbling in a lot of ways. George at one point told me that I needed to do things in my life where I would be talking to doctors and audiences and teaching them what I know about certain aspects of medicine. So this is tonight doing that for George. So thank you for having me here. Now I will try to not mess up this thing too much. So what I hope to do is by the end of the night that we understand what adverse childhood experiences are, why adverse childhood experiences are important in all fields of medicine. It is called childhood experiences, but they don't end in childhood. The effects of adverse childhood experiences carry on into adult life. We'll talk a little bit about that and about the shortening of lifespan in people who have multiple adverse childhood experiences. They affect the community. There are aspects of education, law enforcement, the legal system, social services, and faith-based communities that are affected by adverse childhood experiences. We'll talk a little bit about toxic stress. We all undergo stress. I'm having a lot of it right now, talking in front of you, which is a normal kind of stress, which will hopefully help me grow a little bit. But there are toxic stresses which are devastating to children and to adults in the long term. Want to be aware of the ACE scoring and the resilience scores and why they are important. There's a new and expanded ACE scoring system that includes more than the original 10 ACEs, and we'll talk briefly about that because that has some important consequences and things going on with that. Oops, forward. So as we go forward, I like to start, when I do this talk, to have you just take a look at this picture. And I'm going to tell a little story, and it'll set the tone. And I would like you to keep the story in the back of your mind as we go forward, because it will involve some aspects of the points I'm trying to make as we get into the talk. So imagine that you live near this river. You come here every day to fish. You take the fish from this river, and for want of a name, we'll call it the Lackawanna. And you come here and you fish. You eat the fish, you bring them home to your family, you might sell the fish, you might barter them for food and grain. So you come here every day, you love this place, it helps support you. And one day you're there and you're fishing and you see a log floating down the river. And as you're watching, it's not a log, it's a person thrashing about in the water. So you go and you pull them out and you run home and you get your next door neighbor and you come back and you build a stretcher, you take this person home and you care for him. The next day you come back to the river and the same thing happens again. And the third day you come back to the river and there's two bodies floating down. And within a very short period of time, the whole village is involved in this episode or this activity of pulling people from the water who've been injured, some who have died, some who are just having terrible wounds. And soon everyone is at the riverside waiting to see how many people are going to come floating down. And while you're there, your friend Tom starts walking upstream. And you say, Tom, where are you going? We need you here. And Tom says, we're taking care of the downstream problem. Let's go upstream and see why all of this is happening. That's sort of my vision of preventive medicine. I look at what we see in our society today. We have many, many institutes that look at smoking, look at obesity, look at type 2 diabetes, look at cancers and other diseases, look at suicide, smoking, and yet we haven't made the trip back to upstream to see where this all comes from. And this is impacted a lot by these adverse childhood experiences that we'll talk about. So some of the numbers that we'll show are pretty impressive. Okay, the Adverse Childhood Experience Study. It's the largest, most important public health study you never heard of, and it began in an obesity clinic. Let me parse that sentence for you. It is a huge study. It was conducted in San Diego at the Kaiser Permanente facility in San Diego by Dr. Vincent Felitti and Dr. Robert Anda. They had over 17,000 patients in their initial study. It's an important public health study because since that time there have been over 1,000 papers written using their data, their paradigm for ACEs and what they do, and have been used not only in the United States but in other countries, not only in California but across the nation, and have now been transported to look at other fields. So there's an educational component. There is a component that looks at the legal system and what effect adverse childhood experiences have on that, what effect it has on education and learning for children. So it's a terrifically important public health study, and it's that you've never heard of it. And I say this in all honesty, this study came out in 1999. I, being a very erudite pediatrician, heard of it in 2016. So the fact that you never heard of it doesn't surprise me because I hadn't heard of it either. Over in the audience in this corner is Dr. Jennifer Joyce, who is the person who introduced me to the study in one of her classes. So I thank Jennifer for being here tonight. She's my heroine for getting me involved in this. So it's not. And when I looked at this, we did a summer program, research program with one of my medical students, and we looked at what physicians knew in our service area, and not surprisingly, 85% of doctors had no idea what the Adverse Childhood Experience Study was. And I thought, boy, that's really bad. And then I had to call myself up short and say, you didn't know anything about this. How can you expect anybody else to know about it? And it's your field. So it is an area that I think has lately been getting more and more press and more publicity. I think more people are talking about it. One of the things that I think is that we have to become aware of it and what the effects of adverse childhood experiences are, so that we can look at this not as a medical problem or a social at work problem or a psychiatric problem, but as a community problem. And we have to begin to think, how do we as a community address it? So I think this is going to be a really important thing. And it began in an obesity clinic. This story is fascinating to me. Dr. Felitti at Kaiser was the head of their wellness clinic. He also was a gastroenterologist, and he was very concerned about the rising epidemic of obesity and the side effects of obesity, or the effects of obesity, which are type 2 diabetes, hypertension, stroke, a whole bunch of things called the metabolic syndrome. So he was fascinated by this because it encompassed all of his work. There's fatty liver disease that causes cirrhosis that results from type 2 diabetes and things like that. So he was fascinated by this. So one day he was in his clinic, and the obesity clinic, and thinking about wellness, and he was interviewing a patient, and he said, his mind is racing about obesity and things, and he said to this young woman who he was interviewing, and she had been a person who had gained 100 pounds, lost 100 pounds, gained 100 pounds, lost 100 pounds, and he was talking to her, and he said, went to ask her what age she'd had her first sexual encounter. And she said, but he asked, what weight did you have your first sexual encounter? And she said, I was 47 pounds. And he said, excuse me? And she said, I was 47 pounds. He said, oh, 147 pounds? And she said, no, I was 8 years old when my grandfather started to abuse me. Fascinated by this, the next patient he saw was a young woman who also had a story of yo-yoing up and down with her weight. And he went in thinking, well, what if there's a relationship? And he said to her, in taking his history, have you ever been sexually abused? And she burst out crying. And she said, when I was 12, my father started to abuse me. And he told me that he picked me rather than my sister because she was fat and I was thin. And so I decided to become fat, because if you're fat in the United States, you're not seen. Nobody observes you if you are obese. So she has had this issue with her weight. And every time she would lose her 150 pounds, people would start saying, gee, Mary, you're looking really good today. You know, you're really very attractive now that you've lost all that weight. And her mind immediately went to, I'm going to be raped. So she felt that her being obese was a protective mechanism. So this was an interesting study. Dr. Felitti then talked to his colleagues, and the next 280 patients they saw in the obesity clinic had huge numbers of them who've had adverse childhood experiences, particularly abuse. So they started looking more intently, and they started a prospective study where they looked at a group of patients. There were about 8,000 in the first wave, and then there were about 9,000 in the second wave of the study. And they looked at a whole host of abuse issues and family dysfunctional issues that impact people. And we'll talk a little bit about them. And again, I emphasize that while this says childhood abuse, it's when the abuse occurred, but it's clearly not just a childhood problem. The effects of this extend into adulthood, and we'll talk a little bit about that as we go forward. They did this study. They looked at, initially retrospectively asking people if they had that. Then they took the study, and as they brought in new patients to their clinic, they asked them these questions, looked at their ACE scores beforehand, and then over time compared them to diseases, to risk factors and quality of life issues that affect healthcare utilization and mortality. One of the fascinating things to me was that when you hear the story of someone who's obese, have poor health, they're not taking good care of themselves, at least in my pre-bias days, or my bias days, I would think this probably is a person of color, person who's uneducated, a person who's very poor, probably living on welfare would be my concept. You know, that's the picture I'd expect to see. In the Kaiser study, when they looked at this, they found that they had, of their 17,000 people, less than 5% were not graduates of high school. So when they looked at their population, more than 70% had attended some college and more than 50% had graduated from college. They all worked and had Kaiser Permanente insurance, so they had good paying jobs. None of them were on welfare. And over 75% of the people in this study were white, which is kind of interesting, I thought. So my biases were all shot right out of the water, and I was totally wrong as to my conceptions of what was going on here. So this is the ACE questionnaire, and I don't know if you can read it because it's kind of small, but it basically looks at things like prior to your 18th birthday, because we are talking about childhood, which we define as being up to age 18, did an adult or person or parent in your household often or very often swear at you, insult you, put you down, humiliate you, act in a way made you afraid that you might be physically hurt? Did a parent or other adult often or very often push, grab, slap, or throw something at you? Did a person more than 5 years older than you ever touch, fondle, or have you touch their body in a sexual way or attempt or actually have oral, anal, or vaginal intercourse with you? Did you often or very often feel that no one in your family loved you or thought you were important or special, or your family didn't look out for each other, feel close, or support each other? There's a whole host of these, and if you can read them, we don't have to go through all of them. But basically, they break down into several categories that I will talk about. ACEs are common. Oops, excuse me. So you have fat fingers, these things happen. This is the list of the ACEs that they looked at. In the household dysfunction, they were looking at whether there was substance abuse in the house, parental loss, which could be death, divorce, or separation, or one parent leaving for whatever reason, mental illness, battered mother, and criminal behavior. There were looked at the abuse and neglect categories, which were psychological, physical, and sexual abuse, and then neglect, I'm not sure why the bottom one, which is physical neglect there. So that's when people suffer from food anxiety. There's not enough, or food insufficiency. You don't have enough food to get fed every single day. You're always wondering where your next meal is going to come from. So they say that these are common. In the Kaiser Permanente study, as a percentage, 33% of their population had 0 ACEs. So that means 67, 2/3 of the people that they saw in this 17,000 population had at least one ACE. If you had one adverse childhood experience, you had an 87% chance of having a second adverse childhood experience. So they're pretty common. And about 12% of the population had 4 or more adverse childhood experiences. Now, when you look at the list of what these could be, it's not hard to imagine that you have a substance abusing father who comes home, beats your mother, beats you, maybe can't afford to buy food because he's spending it on something else. I don't mean to single out fathers, it could happen the other way too. But you can see how rapidly you can get to an ACE of 4, 5, or 6 without really working hard at it. There it is. Okay. So then when they looked at their study, they went and they looked at what they called risk factors and diseases, and they took common things that we just talked a little bit about. You know, we have a huge problem in the United States. It's smoking, alcoholism, drug abuse, obesity, physical inactivity, IV drug abuse, depressed mood, this whole list of things here. In the bottom 6 or 7 are things that represent diseases that are increased in people who have adverse childhood experiences. This increased prevalence is really not so much prevalence as it is an increased risk factor. So that in the group that has no ACEs, there are a percentage of people who have diseases. There are a percentage of people who are using drugs. There are a percentage of people who have attempted suicide. But if you have 4 or more ACEs, look at some of these numbers. I'm always fascinated by the IV drug abuse. So if you have no ACEs and then you're faced with having 4 or more ACEs, you have a 10 times greater chance of being an IV drug abuser. You have a 12 times greater chance of attempting suicide. Some of these things are amazing. And other diseases, heart disease, stroke, chronic obstructive lung disease, all have been increased in this population with their higher ACE scores. So what Felitti and Anda found was that there was a progressive number of ACEs in the population. As your ACE score went up, your incidence of disease or incidence of having high risk factors that might set you up for a disease increased in a similar fashion. So I mentioned in my goals that we will talk a little bit about some of the newer ACEs that people are talking about. Now they talk about adverse childhood experiences, which are the things we've just talked about: depression, emotional and sexual abuse, substance abuse, domestic violence, homelessness, physical neglect, all those kinds of things. Now people write about adverse community environments, which are other things that contribute to it. And so poverty in and of itself causes an increase. Discrimination, disruption of a community. I didn't quite understand that until I was at the National Conference on adverse childhood experiences last year in Houston, and they were talking about disruption of a community. They had had a hurricane not too long before that. So their community was totally disrupted. I'd never thought of that as, I was focused on adverse childhood experiences in terms of the abuse and neglect. But if you have a hurricane, the people who are caught in the devastating fires in California have had their community totally disrupted. And when you talk about trauma, it's an event where it's life-threatening or psychologically threatening. So that whole experience has been mind-boggling for a lot of these people. Lack of opportunity. It's easy to say we can all get jobs, we can all move upwards, we're socially mobile, economically mobile. That's really not the case. If you're in certain communities, it's very difficult to be able to do that. So this is just, now we have this whole community-wide aspect that I think is fascinating and terrifying. So why should we care? One of the students who I worked with one summer found this chart. So if you look at the 33%, that's people with no ACEs. 1 in 16 smokes. If you have a medium ACE score of 1 to 3, 1 in 9 smokes. If you have an ACE score of 4 or more, 1 in 6 smoke. And you can look at these things and see your likelihood to be an alcoholic increases almost 11-fold. Your likelihood to be a drug abuser, an IV drug abuser, is 16 times greater. You have a 2.5 times greater chance to have heart disease. You have a 18 or 20 times greater risk of committing or attempting suicide. So the paradigm or the proposition that Felitti and Anda came up with was that, and there should be an extra box on the bottom that has those adverse community effects that then influence adverse childhood experiences. And then the next step up, that has an effect on social, emotional, and cognitive impairment of a particular person, which then can lead to the adoption of health risk behaviors, leads to disease, disability, and social problems, and then to early death. After they had done their initial study, they did a prolonged study that was reported on shortly after that. And they took people and followed them for a period of time and looked at death rates. And if you had an ACE score of 4 or more, your likelihood, or when they averaged this all out, the likelihood of you dying earlier was that you would most likely have a 20 to 25 year shortening of your lifespan. So if I could devise a drug that I could sell that would increase your lifespan by 20 to 25 years, I could change the Geisinger Commonwealth to Denny Dawgert University and, have a lot of money to be able to go on vacations. But that's not going to happen because this entity does not have a quick cure with a drug, unfortunately. So the early childhood adversity, this is a statement that came out from the Academy of Pediatrics in 2012. We're going to talk a little bit about some of these things. We've talked about early childhood adversity and experiences. We'll talk a little about toxic stress. Because this was a pediatric journal, it talked about the role of the pediatricians. I personally think it's the role of all of us to be aware of this. And there's a little bit of developmental science that we're going to talk about. I'm not going to bore you with that. That's a whole semester course at the medical school, and I haven't taken it recently, so I know some of the information, but not all the detail. So positive brief stress, I already told you about that. Half hour ago, I was pacing and walking, and my heart rate was up, and all sorts of things were going on. So that has settled down, thank you. Tolerable stress. There's a serious temporary stress response buffered by supportive relationships. I always think this is kind of like, your grandmother who you've lived with dies suddenly, and that's a big stress. And as an 8-year-old, how do you deal with that? We have no concept of what's going on. So that's where you have a supportive mother or father who talks you through that, helps you get over that. Maybe, that you've lost your favorite pet. He was killed by a car. He drowned in a flood. So it's a stress that really affects you, but it's temporary, and you kind of get over it. And you need some help to get through it, but you can. Toxic stress is what we're going to concentrate on here. Toxic stress is prolonged activation of this stress response in the absence of protective relationships. And probably the most important part of that sentence is the absence of protective relationships. So in a family that's disrupted, it's very hard to have someone there to take care of you when you have this kind of stress. So if you have a family member, the sole parent you have is doing drugs and is passed out in the corner, and you have a problem, you're not going to get a whole lot of help from that person at that particular time. So the lack of protective relationships is a huge, huge problem. This is going to be cool. So back about 25 years ago, maybe a little bit longer, I'm going to just run this video.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this, and then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, come on, why aren't we doing this? Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it, they actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big girl.
It's a little like the good, the bad, and the ugly. The good is that normal stuff that goes on, that we all do with our kids. The bad is when something bad happens, but the infant can overcome it. After all, when you stop the still face, the mother and the baby start to play again. The ugly is when you don't give the child any chance to get back to the good. There's no reparation, and they're stuck in that really ugly situation.
So one of the things that I thought about that, when I was looking at that, I was looking at the timeline when I was preparing this. That baby, from when the mother turns back to when the baby is totally decompensated, is a total time of less than 1 minute. Okay? So think about that when we think about taking children, separating from their parents, and putting them in a detention camp where they have no contact with their parents for days, weeks, months. And think what we're setting those kids up for. I mean, this little girl has a parent who's giving her supportive, loving relationships. I'm sure there's other people who get those supporting, loving relationships who are in that situation. When I was, again, at that Houston conference, one of the women who spoke there was a pediatrician who was from Brownsville, where they had one of the detention centers. After weeks, they finally were able to get in, and she talked about, and she had photos, these were heartbreaking to me. They walked into the detention center. There were fences all around. In the middle of the room were piles of Mylar blankets. Under each of those blankets was a child. She said they were there for about 2 hours, and there was not a sound. So if any of you have children, you get 2 8-year-olds together, you're not going to have 2 hours of silence ever. So imagine the emotional trauma that has been happening to these kids with these separations. I also try not to get too political, but I'm going to get a little political there. But I think you also have to think, what happens if you have a mother or a father who are unavailable? They're passed out on the living room floor. All of this is still going on individually. When I give this talk to medical students, I always like to label all of these patients with names, because even though we have statistics of 17,000 people, an X number have this, they all represent an individual. There's a Mary and a Joe and a Tom and a Dick and a Harry. So they're all out there, and this is not a theoretical thing. This is a real thing that's happening to people in our country. So I'm going to talk briefly about neurobiology. One of the things that's happened since Felitti's study came out is there's been tremendous advances in neurobiology, neurosciences, things like functional MRIs, where you can watch MRIs and see what's happening in people's brains at various times in real time when they're having these events. So, okay. Good to have young people who know how to use this equipment. A lot of this work came from animal studies, but there's been more and more work being done on humans. There are some elegant MRIs that have come out of Washington University, where they've looked at children who are now 8, 9, 10 who've had multiple ACEs, 4 or more. And over time, there are not only functional changes in the brains of these kids, but true structural changes, certain areas of the brain that have to do with lack of control are larger, pleasure centers are larger, the amygdala. The prefrontal cortex, which helps us to kind of regulate our activities, makes us not do crazy stuff, has shrunken in many of these children. So there are definite changes within the brain structurally, and so those things have really been impressive for people to follow. One of the things that also I think is important, and I won't go into a great deal of detail only because I don't know it, the brain produces an orchestrated response to these stresses, but many of the areas that are involved in stress, where we have release of chemicals and things, are also involved in the regulation of emotions and behavior. So we'll talk a little bit about that as we go forward. The hypothalamic pituitary adrenal axis, stress activates this axis. It releases adrenaline and cortisol. Those are then sent out to the body, have effects on multiple organs within the body. These are sort of the things that help us with our fight and flight and with our protection mechanisms. The amygdala, these two little almond-shaped things that are yellow on the thing, on the drawing, are the where our sensory, memory, and attention centers are. It's also the emotional memory system. It's the brain's alarm. You know, you're walking in the forest and you spot a big black bear who's coming towards you. Your amygdala says, get out of here, you know, or, you know, get your gun and be ready to fight. So your fight and flight are regulated somewhat by that. The hippocampus is the interface between the upper brain and the lower brain. It's also very important in memory and learning. Some people label it as the brain's file cabinet. So that if that's damaged, then you have a hard time keeping memories, processing, learning. So that's interesting. The prefrontal cortex, we're all familiar with executive function. It's how we control our impulses. It's where our working memory is. It allows us to think through problems and work through them. And that's the area that tends to shrink with all of this excess cortisol and steroids. This one, absolutely, I like this because toxic stress, and you can see how cortisol is released, goes to all the body systems. It affects the immune system, and there's some evidence that it has an effect on the expression of our genes or epigenetics. It also is involved, the immune system is involved in inflammatory responses and infection. Some people think that a lot of the autoimmune diseases may be mediated through this mechanism, and also our inability to fight off infections may have an effect on what happens to our brains. I'd like to talk a little bit about trauma, the psychic trauma, the Substance Abuse and Mental Health Service Administration, SAMHSA. I had to write that because I can never remember what the HSA at the end stands for, so I just wanted to make sure I knew it. Trauma results from an event or a series of events that is experienced by an individual as physically or emotionally harmful or life-threatening, and it has lasting effects on the individual's functioning and mental, physical, social, emotional, and spiritual well-being. So, again, if you think of, if you're caught in the flood, you're caught in the fire, you witness a drive-by shooting, you've just been missed and somebody else gets hit. You know, these are things that I would think of as life-threatening, and I would probably have a hard time dealing with that. This is the face of trauma. We all know this young man. We've all seen this picture. I have a hard time not crying when I see this picture. And think that if you see this young man, he is just staring. I mean, he is vacant. He is lost. He has no idea what's going on, where his parents are. He has just experienced a very life-threatening trauma. I'm going to show a couple faces of trauma, what happens when kids are traumatized psychically. Top one left is obvious. This is war, and this is our paradigm that we think of most times when we're thinking about this is the post-traumatic stress disorder that happens to many men who've been faced with having to go to battle, been shot at, and have severe deprivations. The bottom left, the little girl, is someone who is just withdrawn, has no contact, and not making any contact or reacting with anybody. Little boy at the bottom, he's got somebody who's lost control. He's in rage. He can't control himself. His action is to fight back. Top is, I'll talk a little bit more about what happens with older kids and how they get into trouble with the law and with the legal system. But one of the things that we have discovered is that many of these mechanisms are perfectly adaptable if you're in a situation where your life is threatened. I mean, you want your heart rate to go up. You want your blood pressure to go up. You want your adrenaline to get flowing so that you can run fast. But when you're left with those and it's constant and you think of that that's your default setting every time, that's not very healthy, and it's not very good for our brains or our bodies. So those things can be very, very devastating. What happens in a lot of cases is that you have a child who has been abused, laughed at, mocked, maybe bullied, and he's sitting here and he sees two people over there. They look up at him, they wave, they smile, they tell each other a joke and laugh, and he runs over and punches one of them because he's sure they're laughing at him. Okay? So these things have tremendous effects on the child's brain. So some of the sequelae, and I'd like to just kind of go through these briefly. Developmentally, there are language delays in kids who've had complex trauma, attachment disorders. I think one of the things that we all have been familiar with, we've heard of the Romanian orphanages, Russian orphanages. When kids came over here, they were cared for, they were fed, they were clothed, they were kept clean, but they had no adult who held them or cuddled them or comforted them. The mice studies about mice being groomed and licked by their mothers and those who are not are incredibly amazing. So attachment disorders can develop. Relational disorders, they have difficulty developing and maintaining relationships. Biologically, there's neurologic delays, inability to regulate the autonomic nervous system, so you're always up. Learning, cognitive, there's attention and executive function, learning difficulties, difficulty planning. In terms of school, this is important. There's a lot of kids who have been labeled as having learning disabilities, attention deficit disorder, obstinate defiance disorder, a whole host of what we call in pediatrics the new morbidity. And these are more psychic traumas. And nobody now people are taking a little bit closer look at what has happened to these children, why they're manifesting with these behaviors, these emotional things. So you can see there's a bunch of studies in the last 10 years or so that shows lower grade point average, more days of school absence, increased behavior problems, expulsions and suspensions. We'll talk a little bit about that because I don't want you to go home all gloom and doom with this talk, and decreased rates of high school graduation. So I'd like to, being at the medical school, I'd like to think of this injury model. So we're driving home on the icy road last night. Our car skids out of control. We have our seatbelt on. We bang into another car. We get out. We have a little bit of a bloody nose. Our airbag deployed, so we may have a bloody nose, may have a split lip. My glasses are fractured. But I'm okay. I'm going to recover fairly quickly. My friends may all ask me why I have black eyes the next morning, but that's okay. Maybe I hit the dashboard with my knee and I've dislocated my patella, or I've torn my posterior cruciate ligament. And again, this is something that I can recover from with therapy and things. Maybe I broke a leg. Maybe I had a laceration of an internal organ. I had internal damage. So now I have to spend weeks or months in the hospital recovering. Maybe my car was damaged enough that I had a cervical spine fracture or a brain injury, and now I'm in a persistent vegetative state. So the same car accident can have different levels of devastation. The same thing happens with psychological traumas. You can have a psychological trauma that's mild, that you recover from quickly. You can have a psychological trauma that's more severe and it takes a longer time. And you can have psychological traumas that are not recoverable from. So I like to think of that as a model of that. This is not, an easy fix. I had spoken to a friend of mine who's involved with the legal system, and he was saying, well, I always thought that these kids had their trauma, they got therapy, they were fine. That's not the case. These things happen, they go on, they last a lifetime. They may be controlled, they may be able to be modified to some degree, but they are not ever gone totally and completely. I'd like to talk a little bit about the effects in the legal system. I just pulled a couple studies that I've come across that have been all out in the last year or two. Illinois did a survey, and they looked at children who were in their justice system. The number of juvenile arrests were almost 60% higher in kids who had ACEs of 4 or more. Adult violent crime is more than 30% higher. And I found this fascinating, that almost somewhere between 77 and 90% of all incarcerated females have ACE scores that are over 4. And I like the next one, the Florida study of their juvenile system. If you compare these, we're looking at the Kaiser Permanente study. ACE scores of 33% of people had ACE scores of 0. In kids who were involved with the juvenile justice system, less than 2% had no ACEs, okay? If you look at the bottom line, where there's 4 or more, that's 12% in the Kaiser Permanente, which we'll use as the norm. It's more than 50% in kids who are involved with the juvenile justice system. This is a big issue, I think, in terms of the legal system. This study from Scotland I just got about 2 weeks ago. And if you had an ACE score of 4 or more in violent crimes, you were 14 times more likely to be a victim of violent crimes or domestic abuse, and 15 times more likely to be a perpetrator, and you had a 20 times greater likelihood of being incarcerated at some point. In the Academic Pediatrics, James Garbarino, who's in Chicago, does a lot of work with death row inmates. And his study, or he was saying that if you look at the population that has ACE scores of 8 or higher, it's less than 0.01%. So 1 out of 1,000 will have an ACE score of that high. When he talked to, the last 10 people he talked to were sentenced to death, all had ACE scores greater than 8. So the higher your ACE score, the more of these traumas you've sustained, the worse your life is going to be in terms of what your outcomes are going to be. So when I originally was looking at this slide, that was going to be the Darth Vader side, and now we're going to go to the Princess Leia side, okay? You have to realize that your ACE score is not your destiny. There are things that can happen that help people who have ACEs. And this now is being labeled as resilience. One of my colleagues at the medical school, Dr. Leighton Huey, is very interested in resilience and is doing some initial work and hopes to do a lot of work with this. And I think this is a fascinating area to me. They talk about in the literature that while you have ACEs like a seesaw on this side and they go down, if you have corresponding resiliency factors, you can lower that down and in some cases reverse some of those things that happen based on your ACE score. So I like this picture of these little dandelions growing out of some macadam that's flipped up somewhere in the world, and I think that's pretty cool. Resiliency is the positive adaptation despite adversities. And these are the things that people have written about. They've interviewed people who've had multiple ACE scores or high ACE scores and have managed to survive and do well and thrive, and asked them what were the things that helped them to deal with this and how did they get through these horrible backgrounds that they had, which in all likelihood, for most people would end up being a devastating effect. So many of them had self-value, they had learned self-regulation, and they were optimistic. They felt they could do something. They had creative problem solving. They had a supportive belief structure. They had healthy families. And they had peer relations that were valuable to them. They had a friend or someone who supported them. They had good academic support, and they had activities that they could do. Maybe they were baseball players. Maybe they were artists. Maybe they played the drums in the band. But they had something that they were good at that could take them out of where they were and get them into something else. And they had a safe and supportive community. I think one of the things that has been fascinating to me since I started doing some of research and reading about this is how much my view of movies, TV, and literature has changed. The year and a half ago, I believe, J.D. Vance wrote a book called Hillbilly Elegy, which was a bestseller in the New York Times. If you read that, it is a classic case story of ACEs and a high ACE score. His mother was a woman who was a nurse, educated, became involved in the opioid epidemic, was in and out of jobs, in and out of relationships. He had I don't know, I stopped counting at 5 different people, 5 different men who lived with his mother over the time. But he had a grandmother and grandfather who were supportive, who, were the people he went to when he had trouble. Now, if you read about his grandmother and grandfather, they beat each other up, they were alcoholics, but they were there for him, and so they were supportive. Dr. Brereton's wife was telling my wife and I the story of, what's his name, Grace? Speedo? The opera singer who, he was in a detention center and somebody heard him sing and nurtured him along. So if you have someone or some supportive person or some supportive factor in your life, you can, I can't say you're going to get rid of these, but you can obviate them to some extent. So the new paradigm, I don't know if you can see the cartoon, I love this cartoon. So the new paradigm that we are recommending that people who are involved in therapy, people who are involved in treatment, now look at is not what's wrong with this person, but what happened to this person. So it's not like this is a bad kid. This is a kid who something happened to him or her that makes them act out, makes them behave in a certain manner. Now, that is not easy, but it is, I think, really where we have to think about going in the future. There's a whole new area out there of trauma-informed care, which talks about having increasing awareness, sensitivity, and responsiveness to the impact of trauma and toxic stress on individuals. Hopefully, what we heard tonight might make us all a little bit more aware of that. And so again, there's that cultural shift. People that I have heard at national conferences talk about how there have to be trauma-informed hospitals, trauma-informed schools, trauma-informed ambulance services, trauma-informed healthcare systems. And so I think these things are things that I hope will come in the future. So one caring adult. Okay, I'm going to tell you a very brief story. One of the things that I had, that Allison sent out last night, and the handouts, if you have a chance to look at that, there's a documentary that was produced by Robert Redford's son, Jamie Redford, that won the Sundance documentary, and it's called Paper Tigers. Paper Tigers, it follows a high school that is in Walla Walla, Washington, and the principal there is a man named Jim Sporletter. And you can see it's called the Walla Walla Alternative High School. And if you see the opening credits where people are throwing desks at each other, fighting each other in the hall, where teachers are taking people aside to try to figure out what's going on here. Jim Sporletter had seen and had heard Vincent Felitti talk about the ACE study, and he said, I will become the principal of that school if you give me the people I need and embed psychologists in there, embed social workers so that when we have a problem, we handle it right there. We don't send these kids home and have them come back in 3 days. We're going to find out what's wrong with this child now, and we're going to work on that. And the whole school was built on that, which is pretty interesting. It's on Amazon? Yeah, and it is fascinating to see what happens to these kids. What has happened over the first 2 years that he was the principal at this school and they incorporated this, their suspension rate dropped 85%. Their expulsion rate dropped 90%. And their graduation rate in 3 years increased by 5-fold. So that's a pretty impressive number for what's going on when you look at how, if we attack this with the right mindset, that these kids aren't bad, they've just had bad things happen to them, and how do we help them get through that? So I'm going to start winding down. Albert Einstein, one of my favorite doctors, not a medical doctor, is credited with having said that insanity is doing the same thing over and over and over again and expecting different results. So if you go back to the original theory of the river, we do the same things over and over and over again until somebody decides we got to do something different. And so I think that that's where we have to go. We have to start looking at all of this in a different mindset. And my favorite doctor of all times, of course, is Dr. Seuss, who said, and the Lorax, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So with that, I will close and ask if there are any questions.
Oh, Maury?
Yes, more.
Hold on.
Denny, in terms of resiliency and the protective factors, I didn't see one of the factors being self-awareness. Is there any effect of the abused child himself being aware and being able to assist in the resiliency?
Yes, Maury, that is a good point. I think I kind of lump that into self-value and self-regulation. But what they try to get these kids to do is to recognize that they are not bad, that they've had something bad happen to them, and then to help them develop their strengths. One of the things that Dr. Yui is looking at is taking these protective factors that are listed here and saying, if we increase those, are we going to be able to reverse these factors? So what we're saying is that this kid is really good at sports, or this kid can recognize that he's out of control, or he recognizes that he has some self-worth. And building on those things and enhancing them is really made a remarkable difference, at least in the Walla Walla school. I understand that some of that has been taken to other school districts. My goal, when I refer back to the river floating down, I would love to see something that happens that everybody who's pregnant, both husband and wife, that have to get child classes, which has nothing to do with the child classes that we went to, which was told you, push 2, 3, you know, how you're going to have your baby, which is wonderful. I mean, it was great. But I think what we really need is for people to know what they have to do when your child, and in pediatrics we see this not uncommonly more, where a parent says, this kid's bad. You know, the kid's not bad. He may be doing bad things, and parents have to learn to recognize that. I had a mother who, every time she came into my office, she had nothing good to say about her daughter. She, verbally abused her, and I was at wit's end with this mother. She got a job in a child care center somehow. I'm not quite sure how. And while she was there, she witnessed what they were teaching parents and how they were taking care of kids, and they were positive in their reactions to their kids, not negative, not yelling at them, not telling them they were dumb or stupid. They were very positive. And she incorporated that into her own child. And after like 2 years, the relationship between that mother and child and the girl's health changed dramatically. So yeah, those things really make a difference, Maury. So thank you.
Denny, can you have adverse childhood experiences from a positive point of view? In other words, one of the parents is, let's say, overly protective and doesn't let the kid do things or participate in things that other kids do. Can that also end up being a ACE kind of thing?
I've not seen it listed as such, John, but in my mind it is, because that kids, like that little baby, they love to explore. They're reaching for things, they're crawling, they're getting into everything. If you're the parent, it's terrifying, but for the child, it's very important that they learn what they can do and can't do. And so developmentally, it's really critical that they do explore, that they do fail sometimes. We all can't be, the all-star first baseman. So for a child to experience some failure and to be supported through that and understand why it's important that they aren't successful or, get something every time they do something, it's very important. So yes, I don't think it's listed as an adverse childhood experience, John, but I could see where it would have a detrimental effect on a particular child.
Thank you for your presentation. This question is a little politically incorrect. However, instead of detention centers, what about daycares, especially for infants? I have a close relative who started daycare for the baby at 4 months, and this particular baby is is more sensitive and than most children, I think. And she was pretty much traumatized by just separation from her mom. And her mom is she's very well educated and very, very caring and a good mother, but the trauma of separation, even part-time for her infant, the infant's now almost 4, and you can see some like attachment issues and security issues, and she can be withdrawn at sometimes she has nightmares and inability to emotionally control herself, and she was going through a phase of like extreme temper tantrums, just being unable to control herself. But she's also a very gifted child, because I know the family, the relatives are extremely high IQ in many ways. And the siblings, her 2 younger sisters, don't have the same difficulties. They didn't have the daycare issues that the oldest had. So I'm curious about early traumatic experiences of separation from the mother in infant daycare. Thank you.
It's a good question. One of the things that you have to recognize in child development is that every child develops at their own pace. We are not born, as we used to call it, as a tabula rasa, a blank slate that we write on. Every child, like you saw that little girl, has their personality from day one. Some kids are real easygoing, they're adaptable. Some kids are very high-strung and very difficult to change from one place to another. Some kids cannot stand any separation at all. Other kids do it and they come back and they feel comfortable with the parent. So some of that is probably the child's own individual temperament, not knowing all the details. But depending on the daycare, some of them are not the best. And I'm not denigrating the daycare that this young woman was at, but sometimes there's a different atmosphere in daycares. And I will tell you, we have a lot of people who are put in daycare, like with adults who require care for disabilities when they're elderly. We don't pay the people who are taking care of our kids and our elderly a whole heck of a lot of money. So you don't always get the people who have the highest education or the best intentions. A lot of times for some people, that's just, they're a warm body, making sure you get fed and dressed and you're taken care of in that respect. But your emotional needs may be totally neglected. So yeah, it is a problem, and it's another area that I think we, at some point as a society, have to look at as to what are we going to pay our caretakers, or how are we going to train them, and we're not going to grab the first 3 people who walk in the building and hire them. But yeah, that's a complex issue, and thank you for bringing that up.
Thank you, Dr. Dawgert. Is there an age limit or any research into an age at which it is no longer considered an ACE?
No longer considered an ACE?
Yeah, it would be considered just maybe a...
The ACE study, because it was originally written as adverse childhood experience, it cuts off the age at 18.
18.
So if you're 22 and these things happen to you, then that would not be considered an ACE event.
Okay.
I think our community and our society has to be aware of how we can affect children and, create ACEs. I know, for example, in the women's prison at our local jail, one woman who has a DUI and has money can pay her bail, and the other doesn't, and she goes to jail for 4 or 5 months. That child is put into foster care and doesn't know where mom is. I just think that can cause a lot of trauma, and I think there are things in our community, our society, we need to be aware of, because I would think those would affect the children.
Thank you for that, Amy. Awareness, I think, is the first step. We need to be aware. I was hoping that we'd make some people aware here. And then I've talked about George Schemmel as my spiritual director. He always told me you had to make sure you were aware of what was going on, to try to understand what was happening, and then to take action about it. We are, I think, as a community, barely into the awareness stage, but I think that that's a very good point, Amy. There are, when you look around and you see what we do, there are clearly issues of how we take care of people, clearly issues of, inequity, clearly issues of things that should not be happening but do. The fact that you end up spending much more time in jail because you don't have bail is almost like debtor's prison to me, but I don't have an answer for that, but I think you're absolutely right about it.
Good evening. One of the things I learned in undergrad was something about the diathesis stress model, and it talked about life situations impacting mental health issues such as schizophrenia, depression, anxiety. Does this study expand into mental health, or is it strictly like heart disease and physical conditions?
I know that in many of the psychiatric units, they look at these things. I don't know that I personally have seen a study on mental health. I'm sure there might be one, or there may be more than one out there. I just have not seen one yet. But the awareness of this is starting to increase so that people now are seeing the traumas and how they affect long-term mental health. There's no doubt that these things do affect mental health. And again, I always have to caution that mental health issues, illnesses are going to happen if you have no ACEs, but the likelihood of them happening or the severity of them occurring increases. Your odds ratio does go up. But yes, I am convinced that many mental health issues are probably related to this or aggravated by it.
Hi, I'm trying to figure out how to question this. So let's say there's a household, 3 siblings, the one sibling's 8, and the rest are younger. The physical demands and needs are met by the parent, but not the emotional. But then let's say the 8-year-old kind of compensates for that role. Is there any sort of study in relation to that on how the 8-year-old's affected compared to the younger siblings?
There are a lot of people who conjecture, but I've not seen any, what I would call a classic study of that. But yeah, that's putting, 8-year-olds are designed to do certain things. They're not designed to care for a 4-year-old, okay? So that puts a lot of responsibility and a lot of stress on a child, and long-term, what I've heard and seen in my own practice is that is not a good situation for a child to be in long-term, but I've not seen anything written or studied specifically about how it affects that child. I could give you anecdotal things, but that's not a study that I'm aware of.
Yes, my question also is about siblings. Is there any research or any studies that looked at individuals with those high ACE scores? Are there siblings? Do they have high ACE scores or high ACE scores across generations?
Good question. My understanding from talking to several judges is that there is an intergenerational phenomenon that they see. When they see somebody in court, they can say, oh, I saw your father, I saw your grandmother, I saw your great-grandmother before me. Okay, so there is an intergenerational phenomenon. There's an interesting debate as to whether that is what I have seen and experienced and that affects me, or if this is something that there's this whole field called epigenetics, where what happens in your life can change the way your genes are promoted or the way they manifest themselves. So whether it's genetic or whether it is, I've witnessed this and this is how I learned to behave is unknown. You had another part of that question I forgot. Oh, the siblings. It's interesting. I think what I've seen has been everybody's been taking individually. I've not seen siblings, though anecdotally, I have talked to some people who had a mentally ill mother, and they were traumatized by that. Their younger sibling was more traumatized because all the family members who were supportive had been driven away by the mentally ill mother. The father, who had been supportive, now he's overwhelmed, so he's totally absent from the third sibling. So as it goes down, I'm not sure if the ACE number goes higher, but the amount of attention and care and support that they get has been dramatically diminished by what's been going on through that family.
This was very illuminating, giving us a lot of food for thought. And speaking of food, we invite you to have a little snack with us outside the door, and continue your conversation informally. Thank you so much.